Thermography is an infrared camera that picks up the heat that's coming off of the body. And it's a very simple test, but it's a test of physiology. So all the other tests that you would look at to look at your breasts, like a mammogram or an ultrasound or a breast MRI, those are all tests of anatomy or structure. And we're looking at the function. So we're seeing things that are earlier. We're not looking at a picture, we're looking at activity. So it would be sort of like people looking at their glucose levels or their A1C on their blood before they get diagnosed with diabetes. You know, what's going on? What's the action that's happening in the body before it becomes something that's diagnosable?
The Vidal Speaks podcast.
Episode 42, Dr. Hilary Smith, thermography specialist, on how to monitor your breast health safely. Welcome to Vidal Speaks. My name is Deborah Vidal, former 11-year LPGA golf pro turned classical homeopath, certified plant-based nutritionist, and wellness coach. Each week here on Vidal Speaks, we bring you knowledge, inspiration, or natural remedies to help you take charge of your health and feel your best. I believe health is freedom and knowledge is power, so tuning in each week will give you the power to take steps towards freeing yourself from the chains that hold you back from having the energy to do all you want in life. No matter where you are in your journey of wellness, Vidal Speaks can help. I promise. Hi, everyone. Welcome back. It's the Vidal Speaks podcast, and I'm Vidal, as you know. Hope you're having a great day. Today, I'm going to talk to you about thermography, and my conversation with Dr. Hilary Smith will show you why it's a great testing method to know about. We're going to speak mainly about using thermography as a safe way to evaluate your breast health. Okay, I know you men out there are saying, I don't need to listen to this one. Wait a minute, please, guys. Did you know that 2,600 cases of breast cancer will be diagnosed this year in the U.S. alone, and 440 men will die from it? Okay, so maybe that's only 1% of all the cases detected, but the survival rate is worse for men because they don't think it can happen to them, so they never get checked until it's too late. Also, if you're a guy, it's good to hear this episode so you can advise your wife, daughter, or your loved ones to get tested in a way that won't fill your body with radiation. Okay, so you may ask, what is thermography? Well, thermography is a test that detects changes in the breast health based on your body's heat signature without coming into contact with the body and without the use of radiation. My favorite thing to tell people is that breast thermography can help detect the early signs of developing breast diseases even years before mammograms and other tests can. Yes, years before. And that in itself is a reason to start having yearly exams before you get any symptoms. So the fact that there is no radiation and that they can detect years before mammograms, those are the reasons why I recommend yearly thermography to my friends, family, and patients. As women already know, breast screening plays a very important part in your health. Women with increased factors are especially concerned, and we all know that early detection is key to any form of cancer or disease. Sadly, though, the only test your doctor will recommend to you is a mammogram, which fills your body with more radiation, and yet even the medical society and the medical world will tell you that the only known cause of breast cancer is radiation. Now, can someone tell me if it's only me that's crazy? But why would I go to get a test that gives radiation when they even tell you that radiation is the main and only cause they know of for breast cancer? This just makes no sense. And like I always tell you guys, if it doesn't sound right, if it doesn't feel right, or doesn't make sense to you, do not let any doctor force you to do something against what you feel is right. Okay, now I can say these things because I'm not a doctor, and you'll hear Dr. Hilary Smith She's much more careful about how she says it. Of course, she has to be. But my job, you guys, is to tell it like it is. That's why I wanted to do my own podcast. So here's something that I found that shocked me, and it was written by Dr. Samuel Epstein, who is a leading cancer expert. He says, the premenopausal breast is highly sensitive to radiation. Each 1 rad exposure increases breast cancer risk by 1%, with a cumulative 10% increased risk for each breast over a decade screening. Okay, here's another thing. Did you know that mammograms use a kind of radiation called ionizing radiation? And it's at a relatively high dose, which can contribute to the mutations that lead to breast cancer. You get as much radiation from 1 mammogram as you would 1,000 chest x-rays. Can you believe that one? 1,000 chest x-rays. And here's some other well-known issues of mammography. During a mammogram, as you know out there, women, they compress your breast tightly between 2 metal plates and they squeeze them together, kind of like that pressed juice machine. Ouch! But seriously, I don't want to make this a laughing matter because it really is a serious subject. Many women say it hurts, but more than that, this compression can lead to a dangerous spread of cancerous cells. I have had a couple friends who swear they got their cancer right after their mammogram. And another problem with mammograms, if that isn't enough already, is they have a pretty high percentage of false positives. I think it's about 7 or 8%. And that means that many women have these unnecessary procedures like surgeries, lumpectomies, or treatments because they thought they might have had a cancer. And even more than that, the fear that comes with a diagnosis is enough to bring on the disease, even if it was a false positive to start with. So why do all the doctors recommend these radiation tests to women? Good question. But finally, you got to know that times are changing and the medical world is catching up to reality. They now have studies that shows mammograms have lots of serious concerns and they may be causing the very disease they're trying to detect. How ironic, right? Many studies in the last 5 years have concluded that they should no longer be recommended. One, published in the British Medical Journal of 2011, confirmed that breast cancer screening may cause women harm, especially during the early years after they start screening. In 2010, the New England Journal of Medicine, one of the most prestigious medical journals, published the first study in years to examine the effectiveness of mammograms. Their findings are pretty much opposite of what you and all of us are being told by doctors and our media. The studies show that mammograms seem to have reduced cancer death rates by only 0.4 deaths per 1,000 women, an amount that's so small it might as well be zero. To put it another way, 2,500 women would have to be screened over 10 years for a single breast cancer death to be avoided. So not only are mammograms unsafe, but they're not saving women's lives as we're commonly thought and being told. Now, aren't you glad I just told you about thermography and that you now know of a safe, non-toxic, no radiation, no pain way to detect any changes in your breast years before a mammogram can anyway? So get online and find a practitioner and schedule your appointment today for a thermography exam. Before I introduce you to Dr. Hilary Smith, I just want to tell you that today's show is dedicated to 2 people. One is my best friend and soul sister, Ellen Kuntz, because Ellen is a longtime breast cancer survivor and she worked so hard to change her life. And she was really swimming upstream against all her family's desires with the kind of treatment that she chose. So I have so much respect and love for my sister Ellen. To get where she is today from all the hard work, I can only just say, Ellen, great job. And I'm so grateful that you stood your ground and you believed in your path. And I love you. So thank you so much for just doing what you believed was right. And the other person I want to dedicate the show to today is Irene McConville. my friend and colleague and homeopath, and we lost her just this past Wednesday, and it's such a tragedy. I just want to send love to her family and all her friends, and really, this is such a heartbreaking experience for all of us homeopaths. To lose Irene is a huge loss. She was such a great spirit and full of joy and such a great healer. So the world will miss Irene, and I just want to dedicate this show to her too. So now let me tell you a little bit about Hillary Smith, and then we'll get on with the show. I know Hillary personally because not only is she a chiropractor, but she's also a classical homeopath, and our paths crossed often when we used to attend seminars together. Then she got into thermography, and now she's a practitioner for that. And I've been doing thermography from Dr. Hillary for over 15 years. She became interested in thermography, which is also known as DITI, Digital Infrared Thermal Imaging, while researching options for her own proactive health. Further studies led her to realize that thermography is an amazing and underutilized screening tool that could help people detect the very early changes in their physiology, and it could be used to track the efficacy of their treatment choices. In 2006, Dr. Smith decided that educating the public about thermography and offering a superior service was where all the roads she had traveled led to. She went to North Carolina to receive her training on the campus of Duke Medical Center through the auspices of the American College of Clinical Thermography. Dr. Smith graduated cum laude from Southern California University of Health Sciences, where she earned a BS in biology and a Doctor of Chiropractic degree in 1984. She received a Doctorate of Homeopathic Medicine from the Hahnemann College of Homeopathy in 1992. In 2005, Dr. Hillary Smith received certification in the First Line Therapy, a lifestyle change program that addresses many chronic health issues, and she's also a certified health coach. Okay, you ready, you guys? Let's go talk to Dr. Hillary Smith and let her tell you all about thermography. So relax, sit back, drive, work out, whatever it is you want to do. But get ready to listen to a great new test that you have to take action on. Here we go. Hi, Hillary. Welcome to the Vidal Speaks podcast. I'm so happy to have you here today because you've been my doctor doing my thermography breast scans for years. And I, as you know, have advised a lot of my patients to do it. So I want my listeners to know about thermography. But let's start by introducing yourself and tell us a little bit about who you are, how you got into this.
Okay, thanks, Deborah. It's so great to join you and your fan base. My original license is as a chiropractor. I practiced holistic chiropractic for 30 years. And within that, I did a lot of nutritional counseling and also studied homeopathy.
That's how we met.
Yes, through homeopathy. I love homeopathy, but it takes someone that's very dedicated like you, I think, to really do a good job. Even though it's so fun to think about life in homeopathic terms, you have to really delve into it, and it's not a light topic.
And when you speak of homeopathy is even one thing, but then patient management, that's a whole nother 10 times more difficult, I think. It's really hard because people are really sick today.
Yes.
It's a big work.
And the repertories are becoming more extensive, and we're exposed to things that people were never exposed to before, toxins in an electromagnetic field, which I would imagine is kind of a big deal. So I think that the very focused homeopaths are the people that the public needs to be seeing. Anyway, I digress. As I do. That's
okay. Those are always fun.
As I do. So how I got into thermography, in addition to my practice that was full doing chiropractic nutrition, and at the time I was also doing homeopathy and some energetic medicine, was really me looking for something for myself. And my mother had had breast cancer, and it was a very traumatic experience because she found the lump herself while she was in dementia and had to have a mastectomy. And it was, just layers of sadness. And the propaganda is that if your mother had breast cancer, you're going to have breast cancer, where the familial history is a very small percentage of people that are diagnosed these days.
Especially these days. Exactly.
These days.
I teach my listeners all the time that lifestyle is far more important than family history and
Exactly.
even genes.
And people say, well, there's no breast cancer in my family, and that's 80 to 90% of the people who get it would say that. But I had that fear because I didn't know better, and my mother had such a traumatic breast cancer. And she's the only one, by the way, in her family. She has 2 sisters. She had a hysterectomy when I was quite young, so I don't really know exactly what happened. But the estrogen that they used to give, well, the estrogen now, but the estrogen they used to get was really nasty stuff. So that may have been what happened to her. I don't even know.
Well, for sure, just giving estrogen in general over the last 30 years has created a huge wave of breast cancer. I know so many already.
And in the beginning, it was so strong. So I had this fear, and I had had some mammograms, and it was always painful, and I was young, and I was always so afraid when I went that I was going to get that diagnosis, and I just didn't want to deal with it. And then when I was studying homeopathy, and I was studying the remedy of Bellis, which is breast cancer after trauma to the breast. And I was thinking about what it felt like to have a mammogram, especially because I had fibrocystic, dense kind of breasts, and it was so painful. It just triggered a thought in myself. What am I doing? This just can't be right. I'm not even talking about radiation. I'm talking about the compression. I just felt for myself that it probably wasn't appropriate, but there was nothing. I didn't know what to do. I didn't know where to go. And I had heard about thermography. This was over 10 years ago. And I looked into it, but there was really no quality thermography in our area, which is Los Angeles. And I found a system that I thought was excellent. And I thought, if I want this, I cannot be the only one. And so I incorporated it into my practice, and I just fell in love with the whole concept of preventative screening, not looking for something that is, but looking at a potential of what could be and then interceding. It's a different way of thinking about breast screening, and it's really hard for most people to wrap their head around it because we've been
brainwashed, can I say?
You can, I won't.
Good, I could say a lot of those things here.
That's right. And so now really my practice is devoted to thermography, women's wellness, and education.
And you're so good at it, and we really need it because it is such a great test. I've known about it. I've been doing it with you for a long time, and I knew
Right.
about it even before that. And I, like you, got out of fear after my pneumonia because I was having still some pains in my chest, and they kind of feared me into doing my first ever mammogram, and it was the most horrible experience, painful, so stressful. I'm not even an anxious person, and I was anxious.
Yeah.
So I can imagine people who have a family history of it or have a lump in their breast or whatever. So I'm so happy you did it. And let's now tell the listeners a little bit about what thermography is.
Okay. And just before I do that, I just would like to say, you were talking about how afraid you are. Well, when mammography is the only test that you're doing, and it does have its place, and they see a little something, and then they tell you to come back in 6 months. Well, not only are you having this cumulative radiation, just let's keep looking, let's keep looking, let's keep looking.
Yeah.
But the stress that it evokes, because people don't know the truth about, is it really anything? Why do I have to keep coming back? And that's so
stressful.
It's stressful, and we know that
chronic stress is one of the causes of cancer.
Right.
And then they're putting people under chronic stress. It's a
Right.
horrible situation. It's like a cycle you can't get out of.
Yes, and then you're so afraid to stop. So what thermography is an infrared camera that picks up the heat that's coming off of the body. And it's a very simple test, but it's a test of physiology. So all the other tests that you would look at to look at your breasts, like a mammogram or an ultrasound or a breast MRI, those are all tests of anatomy or structure, and we're looking at the function. So we're seeing things that are earlier. We're not looking at a picture, we're looking at activity. So it would be sort of like people looking at their glucose levels or their A1C on their blood before they get diagnosed with diabetes. What's going on? What's the action that's happening in the body before it becomes something that's diagnosable?
So because of that, because it's using kind of looking at the action of something instead of the actual structure, that means you can diagnose with thermography much, much earlier, right? Because I know that's one of the real benefits of it.
With thermography, we're not diagnosing. It's a screening.
It's a screening.
Yes.
But they can see things, some action taking place before maybe even a tumor has been formed, right?
Right. So then if we see a change on thermography, because thermography is looking at patterns over time. So people that have something and they want to come in for a thermography, it may be some interesting information, but let's not wait. Let's start young, because young women are the only ones that are on the rise with their diagnosis. Let's start young and let's monitor our health instead of waiting until we have something. So change over time. A thermal fingerprint. These are the things that we see on thermography. It's like a line between two dots. So we need to do follow-ups on thermography. It's not a one-off.
Right.
And that's important for people to understand.
Because you're looking at that pattern over time.
Because everybody's going to be different.
You're looking for any drastic change or medium change from that pattern.
Right.
And we all have our kind of individual thumbprint. Right. I imagine over years, it looks fairly similar if nothing's changing.
Exactly.
Right.
So the things that we want to see early on that aren't even a disease is lymphatic congestion. So we see so much of that in the underarm. And when we do the breast thermography, we're not just looking at what's squished between the plates. We're looking at the underarm and the tail of the breast. So many people have lymphatic congestion. A lot of it is because of the antiperspirants, the crystal stone, or even the deodorants that have toxin in it that will clog up or stop the flow of perspiration.
Interesting. And you can see that.
We see that, and it comes up hot, and you don't want that because, maybe you don't want to sweat, and people are habitually using antiperspirants, some people that don't even sweat. But the lymphatic system in your underarm not only drains the toxins out of your breast, but also your head and neck. So you've got your sinuses, you've got all that stuff in your mouth, your thyroid. You don't want to clog up that sink because where is that stuff supposed to go? So we see that. We see estrogen dominance. I don't see why every person on bioidentical hormones is not doing thermography.
Wow, that's a good point.
Right. Because estrogens make things grow. And you don't want to wait until you have something.
Right. Always better to be preventative. Life is so much easier to catch things or just to do things so that you don't ever get there.
Right.
So thermography is not an MRI. It's not an ultrasound. Right. It's not a mammogram. It's really just a camera that's measuring this thermal heat, correct?
Right. That's coming off of the breath.
Nothing is even touching you. Maybe you can describe, since we're an audio podcast, about how the test is, what the patient does to experience the test.
Okay, great. So we take a series of pictures, and we also do more than breast thermography. We do full body thermography, which is really becoming very popular.
Yeah, I was going to get into that later, but since your specialty is breast, I think it's good.
We're doing a lot of full bodies these days too, but we'll stick with the breast.
I want to get there though.
Okay. So we have people change into like a loose fitting gown because we want the skin to acclimate to the temperature in the room. And then once they're comfortable, but not hot, but not freezing cold, they put their hands up so we can see their underarm, and we take a series of individual pictures. That process really only takes a couple of minutes. So my job as a thermography tech, which is what I'm doing in thermography, is to make sure that the camera is focused and that there are patterns visible so that every temperature shows in every picture.
Mm-hmm.
So the thermography tech can control the heat or the cold in the picture. So sometimes you see pictures on the internet or something and it's so hot or there's so much white, well, then that's not a good picture. It should have everything in it, and there shouldn't be big missing hunks because it's so hot or
Right.
it's so
So you have to
cold.
learn how to balance the camera so it's picking up every temperature.
That's right, because we want to look at these patterns over time.
And so in preparing for this test, you have to do certain things and follow certain set of instructions. It's not complicated, but there are a few no-nos right before the test.
Well, we don't want anything that's going to change the person's true temperature. So vigorous exercise, acupuncture, massage, chiropractic, a day before. No sunbathing. If somebody comes in with a sunburn, it's going to come up hot. I have to send them home. Don't take a big hit of niacin right before you come in and get a flush. Don't drink a hot coffee. The camera that we use, the Meditherm camera, it's a medical camera and it's very sensitive. So we don't have huge rules. We're not putting people in super cold rooms that cameras that don't have the sensitivity might require. It's not a big deal, but we also don't put on deodorant, don't put lotion on your breasts. Is it going to make a big difference? Maybe not, but we want to take the best pictures that we can.
And what I love about it is really it's so easy. You just sit on the stool, nothing's touching you. You just lift your arms, you turn, and you say you're done. And I'm like, that's it. That's so not traumatic.
Right. So we take a front view, and then we take the sides, and then we take the oblique, which is really the full-on picture of each breast, because infrared sees best 100% on its subject. Then I also like to take a picture of the back. It's not going to influence the breast series, but people have pain that radiates from their back into their breast. I mean, your ribs start in your back, but they also go under your breast. So sometimes people have this diffuse pain. They think it's their breast, but it could be muscle spasm. So
I remember when I had my car accident. Remember when I got hit by the car and I had that collarbone thing, how red that looked for a couple of years.
Shoulders.
Probably still is, but anyways, that really shows you how it works because you see all the red areas where the pain was. So
when we're looking at muscles or joints, we're looking at inflammation, whereas in the breast, we're looking at a thermal fingerprint, vascular patterns.
That's it. Yeah, that's a good description there. Now we have to establish a baseline, right?
Yes.
So that just explain how it starts when they start their very first one.
So they come the first time and we do the pictures, and then they come as close to 3 months later as they can so that we can do the same pictures again. And we just want to make sure that it's the same. So maybe we're not going to see anything the first time. It doesn't mean don't come back, because we don't know if something is developing and we want to see that. Or if something does come up, but it's not real specific, when the person comes back, then we know, well, that's your thermal fingerprint. It's kind of like in homeopathy when you're treating somebody. If you don't know that person, you don't know if that condition is going up or going down, right? If they're getting better or they're getting worse. So you need to look at them again. Once we get the thermal fingerprint, that will be the person's baseline for the rest of their life. And then their screening will just be one time a year. And we do like to stay with the annual screenings. Some people will say, well, I'll do a mammogram. I'll do it every other year. Do what you want with your anatomical tests, like your mammogram. But thermography is looking at new changes. And we don't want a lot of time to go by, because the body in its infinite wisdom will try to wall off something that is wrong or growing.
Yep.
And then once something becomes encapsulated, it can become invisible to us. So we want to stay on top of it. So then it's an annual screening one time.
So you start out by the first one, then 3 months later, you get your second one just to be sure that you now see what their thermal fingerprint is.
Exactly.
And then if everything looks good, it's a once a year thing.
Right.
Now, if someone already has a lump detected, and maybe they've already been told by their doctor, maybe they've already had their mammogram say they have it, can thermography still be helpful for that person?
Well, first of all, if somebody has a lump, even if their thermography comes up as low risk or we don't see anything, I always want them to do a test of anatomy, whether it's a clinical exam by a really experienced nurse practitioner, OBGYN, or midwife, or we really like ultrasound.
I like ultrasound.
And that can, really look at those lumps, because when you have a mammogram, if it's a shadow, if you have dense breasts and things don't show up, they do a spot ultrasound anyway. So a bilateral ultrasound, or there's now automated ultrasounds, we want to look at that anyway and see, maybe it's a cyst, maybe it's a fibroadenoma or some kind of benign tissue, but we want to know that. And then we go forward with the thermography, knowing that there's nothing hiding from us, but we do want to look at the anatomy of a lump. I think it's really important.
Yeah, you're really wanting to understand what's there. And I'm just a personal believer that when you put a breast, like a mammogram, and you smash it when somebody has a lump and you don't yet know, let's say if it's cancerous or not, that's just high risk to do that. I know maybe you can't say that, but I can, because I've had friends that swear that they got their breast cancer from their mammogram because...
Or people with implants.
Yeah.
It can,
rupture them.
Yes.
Yeah, and that was another question I had. I might as well ask you now. That's the great thing about thermography. A person with implants can do them. Is there a person that can't do them? Is there anybody who doesn't qualify for a thermography
we
scan?
do a thermography on people with implants. We do it on people that have had reconstruction. We have a lot of people that have had some breast cancer in the past, and they don't want to go through that again, and they want to follow their health. So even if somebody's had a mastectomy, a lumpectomy, we can still be looking at that tissue and their underarms, of course, which is so important. There's nobody that can't have a thermography because it's completely safe.
Yeah,
it's only picking up the heat that's coming off of your body.
No radiation.
No. And no touching and no nothing. But the people that we don't do a thermography on, unless there's something very specific that we need to look at, are girls who are still having hormonal shifts that are very young, let's say under 23. Mm-hmm. Unless they have a lump and they're high risk, then we look at them. Pregnant women, it won't hurt them, but the hormones in pregnancy create patterns that are going to block the things we want to see. And lactating women, because the hormones are going to block the things that we would see.
Yeah, they're probably giving you a false picture than what they're really, what their fingerprint really is.
Right. And then because there is a lot of heat, there could be something hiding under it. So it's just not the optimal time. If someone has had a biopsy or chemo or radiation, we like to wait 3 months after. We want them to be healed, because just the scar tissue or the heat from the radiation is going to come up, and we don't want to scare people.
Well, I was just thinking the same thing, because why do it so early when something might show, and then you're alarming the person? Let it heal and do it then.
And then also that heat from the radiation could be hiding something that's important underneath that we need to see. So those are the instances where we say, please don't. And of course, if they were naked sunbathing and they come red, oh yes, it's happened.
Yeah,
we don't want to take those pictures.
We do live
either.
in LA. We see a lot of crazy things.
Yeah.
But then you now do this test, and then who reads the exam or the test?
So we use telemedicine or electronic medicine. It's called electronic medical interp. And we send our images to a board of certified thermologists that are all medical doctors who have been trained and certified. And it takes, the smartest doctor in the world might not be a good thermologist, because it takes an eye to see these things. But the system that we use, the software is very sensitive to 1/100th of a degree in a pixel. So look, you're never going to be the same in every circumstance. It's going to be hot. It's going to be cold. You're going to be on hormones. You're not going to be on hormones. You're going to be here in your period. You're going to be there in your period. So we are looking at pixel to pixel changes in change over time, and not just a general look. So we send our pictures with the history over the intranet to our interp doctors, and they're able to look at the patterns with about 80,000 pixels in every image, and they're looking at the temperature differentials and the pattern. And then they generate a report, send it to us, and then we send that to the patient. And then one reason it's good to work with a licensed professional like myself is that I can review the report with people and explain it to them.
Yeah, and I know a lot of friends that I found places that didn't live here in LA, and I wanted them to do thermography. I found places that do it, and I noticed a lot of them use the same company that you have. I shouldn't say a lot because it's only been probably half a dozen times I've looked for someone.
Right.
So I think that's a common practice that they're using. Hopefully a board like you do of all these doctors that are really trained in thermography.
And the other thing is that being a part of this group, I see things on the internet, you can't believe everything you see.
That's for sure.
Or people will say, well, they don't read it themselves, so it's not good. I mean, when I did x-rays as a chiropractor, I still sent it to a chiropractic radiologist. Why not have somebody that's good at what they do it?
Exactly.
And
look, most doctors can't read an MRI. They read the report.
Exactly.
And a regular doctor doesn't read an x-ray, a radiologist does. Why not?
And they have the
specialist?
software, they have the sophisticated software. They're doing this all the time. And within our system, it's overread so that we can get second opinions, or other doctors are looking. We're not a one-man band. Nobody's there. Worst case scenario, taking the pictures with an inferior camera, reading them themselves, selling vitamins to correct it.
Right.
Reading it again, look how much better you got.
Right.
I mean, I love the objectivity, and I like that a medical doctor is reading it, because thermography is in my license in California, but in some states it's not, in different licenses. So the medical doctors have a more broad range of practice and scope of practice. So I think that's important. Also, everything is saved HIPAA compliant in a database. So when people move around like they do, they haven't lost their years of thermography. It's in the database. They can go to another practitioner who uses this system, and things can be compared because it's all saved. So it can be duplicated or replicated.
That's great.
Yeah,
that's great.
Yeah.
Time to take a little break. And my call to action today, you guys, is to please send this episode to 5 women you know or 5 women you love, your daughters, your wives, your best friends, your partners, whatever it is. Just please get the word out about the importance of using thermography for your annual breast testing. Remember, an ounce of prevention is worth a pound of cure. So start now and monitor your breast health. And also, I want to remind you that if you feel inspired and you can afford to support the show in any way, that you can contribute by sending a donation through the donate button on the vidalspeaks.com website, or by using that Amazon banner on my site, which sends me a small commission with every purchase. Thanks to those of you that are doing that. And of course, if you have not reviewed the show, be sure to do it, because it sure helps us get others to learn about the show. Speaking of the show, Dr. Hillary Smith has offered a discount for anyone who wants to do thermography with her. So check out her website and contact info in the show notes and make an appointment and get your Vidal Speaks discount. And lastly, remember I told you I was going to tell you a little tip or something each week in the intermission. So my thing to tell you about this week is about how to prepare a pomegranate, because I bought my first pomegranates. Lloyd and I got them at the farmer's market this last Sunday, and I just remembered this would be a good thing to share, because opening them up and picking all those little seeds out is so messy that most people avoid eating fresh pomegranates. But here's what you do. You fill your sink with water and you put a strainer in the bottom of the sink. And then you either start cutting the pomegranate just a little, and you put it underwater and you break it open with your hand while it's underwater and kind of in the strainer. And you will see that all the seeds sink to the bottom of the strainer and all that white stuff floats to the top. So it's super easy to separate it out. And you just pick out the seeds and stuff, and you do that underwater, and they keep dropping into the basket. It's fantastic. Sadly, though, you'll get a big basket of seeds, and it's hard not to eat the whole thing at once. That's what I did last week. Okay, you guys, here we go now. Back to the show. Okay, so if your test comes out normal, you're good for a year. But let's say there's something suspicious. Then what? What do you recommend?
And I would even say, and I talk to my people that have been coming for a long time, I always ask them, have you had a manual breast exam? I want people to know their anatomy as well as their physiology with the thermography. Okay. I think there's a lot of misinformation about that. Thermography is great, but nothing is perfect.
Yeah, nothing's 100%.
Nothing. Not a mammogram, not a breast MRI, not an ultrasound, nothing. So let's take the best of both worlds and combine it. So I like people at least to have a professional manual breast exam to make sure that everything feels normal and there's no lump or something that could be hiding. If we do see something, it just depends what it is. And people know. If somebody just went on estrogen and their pattern changes, I mean, we can connect the dots on that. You need to do a saliva. You need to get to the bottom of that or detoxify, and we need to see you again.
Well, let's say it turns out to be truly a cancer.
Well,
so that something looks really suspicious, nothing's changed in their life. What's the first step for them?
So I will ask them to do additional testing depending on how their practitioners feel, because I'm not their practitioner. But a lot of people like to do an ultrasound, and it's hard to find these days because the status quo is mammogram first, ultrasound second. Well, even if the person has known dense breasts, and we know that mammography is not an effective test with dense breasts, and that's why laws are passing in many states that women have to be notified of that. Why do they still have to go through it? I don't get it. I know it's probably there's some medical issue around it, but I would like the person to at least start with an ultrasound, and then they may need a breast MRI, and then they have to figure out what they're going to do.
Right. That's totally up to the individual at that point. Let's say someone decides to do chemotherapy and radiation, the traditional treatment, or they choose to do completely natural treatment.
Right.
Can thermography help them determine whether their treatment is working?
Absolutely. So we're monitoring a lot of people that are doing natural treatments or who have done some, like maybe a surgery, but they don't want to do chemo and they're doing dietary changes or they're working with practitioners. So we want to see what you're doing is working. The activity and the inflammation or the blood flow that we saw around that area initially is decreased. But then at the same time, I've seen people that have done a lot of alternative stuff or conventional stuff, and we see an increase. We see it spreading. We see it going.
What great information it is, though, to kind of get a feedback on
and it's objective.
What you're doing.
Right. So people that are doing something energetic, maybe they look good on the energetic machine and their practitioner's like, you're getting better. But again, it's always good to step away and have a non-toxic objective finding. When we tell people, okay, what you're doing isn't working, we're not making a recommendation of what they should do. We're just saying, change your game.
Right. And how often would they want to do a scan to see how their treatment plan is working?
I think it depends on the individual person who they're working with, but 3 to 6 months, not wait a whole year.
Yeah. And when someone's under chemotherapy, are they also able to monitor that, or is it too hot because it's so toxic?
Yeah, there's too much activity. So we wait for them to be done 3 months.
That's kind of what I figured, because it sounds like that toxicity would make it so hot. And can you talk a little bit more? I know you said it's not perfect, but just about the accuracy rate of thermography. I don't know if that's the right term, but there's always these like margins of error.
Yes. Well, thermography is a very sensitive test, but it's not a specific test. So we have a great sensitivity as far as seeing there's something, but we don't really know the what or the where. That's where the anatomical tests come in. So there was a study done probably about 8 years ago where they took people with a known cancer and they did thermography studies on them, and they weren't doing change over time, which is really the way to go. And they weren't using a medical camera. They were using more of an industrial camera that averages temperatures. And the sensitivity was in the high 90s. But we know from our experience over time in tracking things that old lumps, things that are hidden from us, 17% of those things can hide. And that's why we want this to be a screening for prevention and for tracking treatment. But if there is a lump, always let's take a look at it in another way so that we know. And then once we know that it's a cyst or a fibroadenoma, great, then we're good to go. But at least one time, I want that anatomical look.
Yeah, you're just not only covering your bases for you, but for the patient, because
oh yeah,
why would they want to wait and then suddenly you find out you should have done it, then you really regret things. I always think it's better to be proactive and use this as a great tool. But if you have any doubt, do one more thing like an ultrasound.
When you put those things together, that's a beautiful complementary combination.
And a breast ultrasound is not an invasive
no, not
treatment,
at all.
So
no.
It's like you're still doing something pretty benign.
Yes, absolutely.
And I just wondered, I don't know if you can say it, but I can. But, the one known cause for sure, even from the medical society, will say that radiation causes cancer.
Right.
It just never made sense to me to do a screening that's radiation. You're putting radiation directly to the breast.
To the breast.
Right to the breast with a mammogram. That's why I never did it.
Yeah.
Because I just said, why would I want to put the very thing into my breast that causes breast cancer?
And these new breast screens, like the 3D, that's a CAT scan.
Wow.
That's a lot of radiation. We just heard at our conference, that's as much radiation as having a regular mammogram your whole life. And then they say that the digital mammograms are less radiation, but I think they leave the camera on longer. So I think it all comes out equal in the wash. And for a young woman with dense breasts, that's where you really want to catch these aggressive cancers in somebody young. Listen, all these breast cancers are different, and I'm definitely on the preventative health side. I'm not on the cancer side, but there are some cancers that are so aggressive, it's hard to stop them. And there are so many that would never be anything. So the Canadian study, which people can Google, that came out about 3 years ago, it was a 30-year study. It showed that mammography really had not saved any significant number of lives compared to a manual breast exam and finding a lump, and that the women without a lump were overtreated 73% of the time. And what's shocking about that is that their treatment wasn't an aspirin.
No, exactly.
You know?
Exactly. And now I know on your little pamphlet, and I've also read online, it talks about how many cells can be detected when you do a thermography scan versus how early a mammogram. Do you know them by heart? Do you know what that is?
Well, thermography can pick up cell changes usually within 2 years. But of course, everybody's going to be different because of their age or their estrogen levels. But all doctors will tell you that cancers grow for 5 to 8 years before they're ever detected.
On a mammogram?
Yes,
on a mammogram.
Or that there's a lump. There's something happening. There's a clinical gap between when something starts and when you have a disease. It's just like people that maybe have a little bit of back pain and they don't have severe osteoarthritis and spurs and, something happened. And then if they would take care of it, maybe, we never know, they wouldn't get arthritis. But you don't wake up in the morning fine and then you have severe osteoarthritis. It's a process of many, many years.
Right.
And that's what we want to see, that in between. We want to see the beginning where people can step in and do something and stay healthy. It's just a different way of thinking because we're so used to early detection.
Right.
But what about prevention?
Right. Well, I know because I lost 8 friends on the tour to breast cancer, and they were all told that their tumor has grown for 10 years before it even becomes detectable.
Right.
And that's what I love about thermography. You can detect the cells so much earlier. That, for me, is a reason enough to do it.
Exactly.
Because if I can gain 8 years on something that a mammogram I have to wait 8 years before to even detect it, in addition to the radiation, it's not even a question for me. But as you know, in my practice, I always would ask people, and then if they would tell me they have to do their mammogram, and I would say, oh, here's Hillary's card.
Yeah.
Please, don't do your mammogram. Just do a thermography. ends up you have to go down that route, do it at the end, but do something that's way sooner detected and way healthier and less invasive. And a lot of them were so happy I told them that because they'd never heard of it. So it's really, really important. And I just think that, like you said, my first friend on tour that died of breast cancer, she was 23 when she was diagnosed.
Wow.
And the younger that you are, usually the more aggressive the cancer is, right?
Absolutely.
And I remember her telling me that, she had a tuberous mastectomy, did all the chemo, the radiation, everything. And that was kind of worse than the cancer, as most cancer patients say in the end anyway. But gosh, I know so much more than I know now. And it's not our role to make somebody's decision about how they're going to do their treatment anyway. It's our role to help educate the people so that they can make the decision that feels best for them.
And we're giving them information. What I found now doing this for over 10 years is that when people take a breath, think about it, explore their options, feel and listen to themselves what's right for them. If they decide to have surgery, radiation, and chemo, they're happy. If they decide not to do that or do a lumpectomy and then do juicing, or people know in their hearts what they are comfortable with and what they want to do.
Yes.
But when the people that I find have regrets are the people that got real scared and they rushed into something. I've seen women who are 80 years old with a ductal carcinoma in situ grade 0, which may never become anything. And as Christine Northrup says, you might die with it, but you won't die from it.
Right.
Having a mastectomy.
I know people already. It's just blowing
they're
my
old,
mind.
and that is a hard surgery.
Yeah, it's crazy what they're doing today. I know. But speaking of that, let's talk a little bit about part of that is the doctors are instilling fear into women to get these tests and to get these radical surgeries and these radical treatments. I just know from my own friends, some of them felt very clear about what they wanted to do, and they got so pressured by the doctor that they almost started. I had this guy on the podcast, he had colon cancer, and he was so 100%. He said I was 190% sure I was going to do nutrition and juicing. Told my wife I'm not doing chemo, whatever. He agreed to his wife that he would go meet with the doctor anyway, just to tell him he wasn't going to do it. He walked out of that appointment so pressured by the horrible stress that the doctor put him under, making an appointment to go get his chemo tube in. Mm-hmm. He ended up not doing it when he got home. He said, I realized, no, that doesn't feel right to me. And like you said, I tell people that all the time. Think about it. Make the decision for what feels right from you, not from the pressure of your family, which is another huge pressure, because a lot of times you're the alternative person in the family and all your members don't know anything about alternative medicine. So they want you to go do what the doctors are telling you to do because they believe so full-hearted in these doctors. And it's not that the doctors are wrong, but those treatments aren't as successful as people think. Even if it's your husband or your children, you still should have the right to treat your cancer the way you want it, and they should respect that regardless, because we in the end, we all have to live with the decision we chose.
That's right.
And you're right. The people that I know that did it the way they want to, they've accepted their death or their recovery in a way better way, and they didn't go along the way with fear, because they made a decision based on education and their heart.
And even if they decide that they're comfortable doing conventional, they still need to realize that the cancer was a symptom of an imbalance. It's not like I had this foreign intruder that entered my body and we cut it out and now I can do whatever I want. I mean, the donuts and the crap that they give to these cancer patients
in the hospital after their surgeries.
Or we're going to reward you because you just finished your chemo, so we're going to give you this gigantic cake. I mean, you still have to do the lifestyle stuff.
Exactly. You will never get away with not doing that in any disease.
That's right.
That's just...
And then I think there's a book, Radical Remission, and there's a lot of talk about just healing your past. And I know that this fits in very well with homeopathy, but you can't just work on the physical too. I think people that do well are also looking at their spiritual and emotional wounds.
Yeah. I know a lot of the cancer patients that have come on as a guest that healed themselves all say it was a combination of doing lifestyle changes, taking stress out of their life, finding their forgiveness, spiritual balance, and of course, physical
Exactly.
things. Of course, it's a balance. And Dr. Master says, and he was on my podcast, and he says, cancer is a process. It's a process that's gone wrong. You're not going to cut off your breasts and stop the process. And once you understand that, you're just suppressing a symptom, but the process is still ongoing. It will make less sense to go do that and to not decide to do the big changes emotionally, spiritually, physically, whatever it's going to take to.
And what about this new
back.
trend of the prophylactic bilateral mastectomy?
Well, thank you, Angela Jolie.
And maybe it was right for her, but she was touted as a hero, and maybe she was a hero for herself and her family, but that doesn't mean because she did it.
That it's right
just
for
because
other
Kim
people.
Kardashian did a sex tape doesn't mean we should all do it.
Exactly.
Just because Angelina Jolie did something. I mean, this is an intense surgery that people do because they don't want to have to be afraid.
And it's irreversible, and it's not doing one single thing to stop the process of cancer.
Right.
And what a waste to put yourself through such a surgery and put your body under that state when you're not doing anything to change the underlying cause. So that's what I try to teach being a homeopath, how much we know about suppression, and just that is the whole thing. So my listeners are used to hearing that from me because I go over that with everything, but it's true. You can't just cut off a symptom.
Exactly.
It doesn't work like that.
Yes.
So I'm curious, are there any medical doctors that are recommending thermographies, or not too many, or where's it stand now?
Yes, I think there are more. We just got back from our convention of the American College of Clinical Thermology, and there were many medical doctors there. The president of our organization is actually a breast radiologist, so he believes in all the tests, but he sees thermography's role in it. We had hospitals from China there that were using thermography to look at deep vein thrombosis and the possibility of throwing a clot to the lungs.
Wow.
Really interesting OBGYN from Hungary that's correlating thermography findings with fibroids and ovarian cysts. So that was interesting because when you're doing a screening, maybe you're going to find out something about endometriosis.
Yeah.
A way to monitor it that's not so toxic. So I think integrative doctors, functional medicine doctors, I think there's still a lot of misunderstanding about thermography. Some people that think, well, we'll do thermography 1 year and do a mammogram another year. It's not the same thing.
Well, Hillary, too, I think that as a subject or a practice of something gets more known, there's always going to be those things. Look at homeopathy. It's so old now, from the 1700s, that people can say all these goofy things about it. But in the end, it's been around so long that buys us a little sanity. But when something is new, you're going to have people writing all these things, and it's going to confuse a lot of people. But in the end, I always believe that truth comes to the top in the end. So I have a feeling that even though that stuff is out there, people just need to do research, meet with people like yourself that are experts at it to hear the truth, and don't just believe the first website you read.
Well, I think you don't have unrealistic expectations of anything.
Yeah.
But thermography was FDA recognized as an adjunct of breast screening in 1982. And with the advent of digital photography, everything really changed. And I think that when the studies have come out about mammography and its limitations, people start looking for other ways of viewing their health. And I think more people want to stay healthy. They don't want to go down that road.
Exactly. I think that movement is definitely happening. And do you feel that thermography is going to be covered by insurance companies soon, or not anytime soon?
There was a hearing a couple of years ago, and my mentor and the creator of my camera did testify, but they gave so little. It was like $17.
Yeah.
I think that people are going to have to get used to paying a little bit of money for their health. I don't know when it ever started that if our insurance will pay for poison, we'll take the poison instead of buying organic food, or,
Right.
in the end, it's going to cost more to be sick.
Yeah.
So the other thing that I personally feel is that if thermography was covered by insurance, the good thing would be that people that can afford it, and it's not crazy expensive, would have the opportunity to do it. But then everybody that said we were crazy now will start to do it because they can build the insurance. You know how that goes.
Yeah.
And if you do not have a holistic point of view, then when you start to see early changes, you don't know what to do with it, because it could be 5 years before you can diagnose something. We see things in people's mouths that they have a lot of inflammation or infection in an old root canal or under a crown. And when they go to their regular dentist, the dentist said there's nothing there. Then in 5 years, the person will come back and say, remember that thing you saw 5 years ago? And my dentist said there wasn't anything. Well, now I have an abscess.
Mm-hmm.
But if you don't have a holistic picture, you don't know, okay, there's something, you're just moving in the wrong direction.
Yeah.
Let's get back on course. If you're just waiting until there's a thing that you can cut or medicate, you wouldn't know what to do with thermography anyway.
Well, I just think it falls under healthcare, and sadly, our insurance is sick care, and anything that's good for you really isn't covered by. Look at homeopathy's never been covered, and then the few medical doctors that do bill it, it's like $5 they get back or some ridiculous thing. It's an insult to them.
And that's why all the good doctors that spend time with people aren't even taking insurance anymore.
Exactly.
But it's an investment in your health that will, and then you see people, they get sick, and they spend all their money to get well. If they would have just dollar cost averaged on the way.
It would have been so worth the organic food, looking back to what they have to do now.
Exactly.
So that's what I always say. My grocery bill is my healthcare insurance.
And we want to die healthy. We just don't want to get sick.
Yeah.
So it's better to do what we can to stay vibrant.
And lastly, like, what are some of the things that you scan other than the breast? You do like brains and...
Well, you can't do the brain because we're skin temperature and the brain's under the skull. But when we're looking at organs in thermography, we're not looking at the organ. We're looking at the expression of the organ via the nerves, the dermatomes or thermatomes on the skin. And again, it's a screening. We can't be specific, but we can give people an early warning. So we do the whole body, the head and neck. So we're looking at the mouth, we're looking at TMJ, sinuses, we're looking at the thyroid.
So when you do the head, it can see the sinuses, but could it see any clot or any inflammation?
We can see
brain?
Inflammation in the carotid artery, which is very close. And sometimes you can see that whole line of the carotid inflamed. That's an indication of systemic inflammation. And you want to figure out why you have that before you get hardening of the arteries and plaquing and the potential of a stroke. That's a great thing to look at. And a lot of times when we see that, I will have the person have an ultrasound of their carotid because we want to make sure there is no occlusion yet. But if it's still, completely open, hey, where's that coming from? Is that your gut? What is that? Why do you have that? Why are you 35 and you have inflammation in your carotid? And then we can look at it over time. It's getting worse. It's stable. It's getting better. We're looking for pain. People that have unexplained pain, they've done the x-rays, the MRIs, but they don't know the root of their problem. With looking at inflammation, we can see, is it the low back or is it caught at the sciatic in the buttock, or is it the hip, or is it a deep vein? Where's the origin of it? And that really helps people get more specific treatment.
So is there any website that someone can go to that is interested in looking for someone in their area to do a thermography scan?
Well, they can look at our website, which is pictureinside.com. That'll take you to the breastthermographycenter.com, but that's really hard to spell. So even for us.
I'll put it on the show notes.
Okay.
Don't worry.
Okay. So it's pictureinside.com. And if people are in an area, they can email us and we'll try to hook them up with the best person that we feel can help them in their area.
Fantastic.
Yeah.
Hillary, I'm so happy you're doing this because I love thermography, and it really is such a great tool because it's so non-invasive. And it's so non-invasive, and you get so much information from the report. So thank you for doing this in LA and being my doctor and now being on the show and helping all the listeners learn about it.
Thank you. It was my pleasure. And now we're going to do your scan.
Yay.
Okay.
Thank you.
Thank you.
I hope you enjoyed that interview, and I'm so happy I got the word out to my podcast family about thermography. I know it's a great tool to detect inflammation too and to help with so many other diagnoses, but I wanted to focus on breast health because of the dangers of mammography and how many women are being told they are safe when they are not. Before I sign off today, I guess I have one more thing to get off my chest, as they say. Well, it was just Breast Cancer Awareness Month all of October, right? And you, like me, I'm sure have been seeing all the pink ribbons. Well, at first, you want to feel like, wow, how nice, because we're making such a statement out there for all those women who have suffered with breast cancer. And believe me, I've lost 8 friends while I was on the LPGA tour, not to count all the ones since then. And as I told you, my friend Ellen went through it. So I'm as sympathetic as they come. But did you know that this campaign with the pink ribbons is funded by AstraZeneca, the pharmaceutical drug company that makes a drug called tamoxifen? This drug has been very profitable for AstraZeneca, with sales over $400 million annually. But it's also a very controversial drug. It has significant side effects that have been linked to uterine cancer, liver cancer, heart disease, osteoporosis, depression, eye damage, blood clots, and even breast cancer, the very condition it's supposed to treat. But here's the horrifying fact about this company. AstraZeneca used to be called ICI, or Imperial Chemical Industries. This company is a chemical giant and one of the world's top producers of organochlorides, which are chlorine-based industrial chemicals that are used in the manufacturing of a wide variety of compounds, including Agent Orange, PCBs, and DDT. Organochlorides are known as carcinogens, and studies have found them to be specifically associated in increased incidences of breast cancer. So we have a very large and profitable corporation with reported sales over $14 billion that makes its money from industrial chemicals that cause cancer, and then they make the very drugs that treat and potentially cause more cancer. Incidentally, they have a large financial stake in the cancer treatment centers also. So how convenient if you're causing so much cancer in the world to support cancer treatment centers, right? Okay, so maybe you got it by now, but I can't support any of those pink ribbon campaigns, sorry. When I look out at all these pink ribbons, I send love and healing to anyone out there going through breast cancer. If you've been on that path, I take my hat off with the utmost respect to you. No matter what path anyone has chosen to face their diagnosis of cancer, it's a huge life challenge. I'm not being judgmental here, I promise, about who chooses what treatment. But when I see those pink ribbons every October, I just want to honor the women having had the breast cancer. But I look at all those ribbons and I honestly think something is wrong in the world for so many people to be diagnosed with cancer. That's the question we really should be asking. Why so many pink ribbons? Because every one of those pink ribbons that are being worn by somebody means that they know somebody that has breast cancer. That's just too much cancer, and we need to address what is going on instead of advertising a drug company that's not doing anything to really cure cancer. I personally like to use the month of October not only to honor all the women having had breast cancer or having breast cancer currently, but also to get the word out about the healthy things we can do to change the future and to truly change these statistics. Things like eating a plant-based diet, eating whole, natural, organic foods that aren't processed, getting exercise, spending more time in nature. And the one thing that's really becoming more and more difficult is avoiding as many chemicals as possible. There are many brilliant minds out there curing people of cancer with natural methods. This is what I see when I look at each and every one of those pink ribbons. And I feel obligated to get the word out there because the statistics can really go down, not just become twisted around to make it look like some drug company's really making an impact on cancer. I don't believe their drugs are working. Sometimes you just have to reinterpret a symbol to mean something more meaningful. So how about you? How do you feel when you see those pink ribbons? Okay, you've heard enough of me ranting today, you guys. But I hope you take this episode very seriously and you remember to share it with 5 women in your life. And also, don't forget to call Dr. Hillary Smith for your thermography appointment and mention that you're a Vidal Speaks listener and you'll get your discount. That's it for now. I'll see you again next week. You know what time it is, right? It's time to say goodbye. Vidal has spoken. Remember, you heal with a plant-powered diet, homeopathy, and detoxing, of course. Peace. Be healthy. Be free. Live life.